into the room, check for precautions. I check the surrounding area for hazards. Do hand hygiene. And hello, sir. My name is Rob Antonoff. I'll be your student RN today. Your doctor's ordered a head-to-toe assessment. Are you willing to comply with me?
Yes.
Great. Can you verify your name and date of birth, please?
Yes, Justin Sears, 5/19/1983.
Okay. Do you know where you are right now?
I'm in Rob's house.
And do you know the date?
Yes, 3rd.
Okay, great. Patient is alert and orientated ×3. On a scale of 0 to 10, what would you rate your pain currently?
0.
Okay, 0 it is. All right. Next thing I'm going to do is check your general appearance. So patient's face and body are relaxed. He's able to hear me. His speech is clear and articulate. His skin color is appropriate for his race. Patient is nourished and hygiene well nourished and well hygiene. Okay, next I want to move into the neurological part of your exam, sir. Go ahead and stick up your arms. Pull them all the way back, fully, and back down. All right, the patient's range of motion is full for the upper body, as well as able to respond to motion and verbal stimuli that I give him. All right, next you're gonna head and stick out your arms for me. All right, go ahead and push up, push down, grab my fingers and squeeze. Upper body strength is good. Next, I'm gonna check for your eyes. All right, go ahead and look straight ahead for me, sir. Okay. Patient's pupils are round, reactive to light, and constrict. And I would say his pupil size is 2 millimeters long. Go ahead and go ahead and close your eyes. All right. I'm going to touch you in 4 different places. Please tell me location of where I'm touching you, okay?
Okay. Right cheek, left arm, right arm.
Okay, and over them. And would you say that the sensation was dull or sharp?
Dull.
Okay. Patient sensation is good. Okay, go ahead and take a swallow for me. All right, patient's able to swallow, no sign of aspiration. We're moving to the respiratory part of the exam. Patient is on O2. He does not need a...
Sorry, apologize. I'm sorry, what's up?
Patient doesn't need a nasal cannula. I'm going to go ahead and check your respirations. Patient currently is non-labored breathing. Go ahead and pull down your gown, please.
Okay.
Okay. Go ahead and check for respiration. Go ahead and breathe in and breathe out. And again. And again. And again. Okay, go ahead and sit up, please. We're going to do the same thing. Go ahead and breathe in. And out. And again. Okay. Go ahead and lay back down. All right, patient's lung fields are clear and there's no adventitious sounds noted at this time. The doctor has not ordered a incentive spirometer, therefore we do not check for that. All right, next we're going to move into the cardiac version of the cardiac part of this exam. All right, I'm going to have to move you down, please. Thank you so much. All right, first thing I'm going to do is check the apical pulse on the apex part of the heart, compare it to the radial pulse. Okay. Okay, apical pulse is normal and matches with the radial pulse. Now I'm going to check both radials. And both radial pulses are equal bilaterally. All right, now please stick out your hands for me. Okay, capillary fill is under 3, therefore that is good. All right, next we're going to move into your valve sounds. I'm going to check each valve twice, once with the diver, once with the bell. Okay. tricuspid, bicuspid. Now with the belt. Aortic, pulmonary, tricuspid, bicuspid. All right, upon listening to that, you have no adventitious heart sounds at this time. Go ahead and put up your gown, please. Thank you. All right, now I'm going to pull the gown up from here. I'm going to check your abdomen. Looking at it, it looks flat. Umbilicus is midline. If you pull up a little more, I'm going to check for your vowel sounds. Listening to all 4 quadrants. Okay. Vowel sounds heard in all 4 quadrants. Next, I'm going to go ahead and palpate them. Okay, you have it down your shirt. There's no distension, no bumps or lesions found. Sir, when was your last bowel movement?
This morning?
Okay, and how are you tolerating your diet currently?
Well.
Okay, good. Next, I'm going to go ahead and ask you for your elimination for urine. Are you urinating regularly?
Yes.
All right, how would you say the color, clarity, and amount of urine you're doing each time?
It's clear and yellow and probably about 200 milliliters.
Awesome. Okay, great. All right. Next, I'm going to go ahead and check your feet. I'll assess the legs for posterior edema. Okay, now note it. Now we're going to check your lower muscle strength. Again, push down against my arms. Push up. Okay, great. Now we're going to check your range of motion. Go ahead and lift your leg all the way to your stomach. Great. Next leg. Okay. All right. Patient has full range of motion. He's also has lower muscle strength. Has fine lower muscle strength. All right. Next, we're going to check your posterior tibial pulse. Equal bilaterally. Dorsals. All right. Equal bilaterally. All right. Next, we're going to move into your skin integrity system. All right. I'm going to check your turgor first. All right. Turgor is good. Skin is warm and dry. Again, the color is appropriate for his race. They're assessing his body. There's no lesions, scars, or wounds. Therefore, he doesn't have any dressings. I don't need to assess for that. He doesn't also have any IV, so I don't need to assess for any of those as well. Next is going to be the activity level. All right. Basically, the patient is fully ambulatory. He is he's fully ambulatory. He's able to move freely from his bed to chair. He doesn't need any assistive devices. I would say for his fall risk on the Morrison scale, it would be a 0. Also on his skin integrity, I would say on the Brady scale, he's a 23 because he has no skin breakdown. There's the head of the bed. Since he's ambulatory, the head of the bed is at the appropriate level, and the head of the bed is put down to his comfort. I'll go ahead and move into the closing part. In closing, I would say that I would make sure the bed is fully down, the brakes are on, the side rails are up appropriately, his call bell is in reach. There's no need for a bed alarm since he's fully ambulatory. I would then go ahead and hand hygiene and exit and document my findings.